All right, hi everyone. I'm Nick Lees, and welcome to Digital Health on Air. Today, I'm joined by Ryan Winkler, who is Practice Director at the Cybersecurity and Compliance firm 360 Advanced. So, Ryan brings with him a wealth of knowledge on elevating your security posture, and as cybersecurity continues to grow and be like top issue in the healthcare industry, it's a great time to have him with us. So, Ryan, thanks a lot for joining us today. I thought we'd just kick off and get started with your perspective on the importance of security and compliance across the healthcare industry, from vendors to health systems.
Yeah, no, I appreciate it. Thanks for having me. I'm really excited to work with you guys on this. And, this is definitely my wheelhouse, and I could talk about this for days. So, in effort to not bore everyone, let's, definitely jump in. And regarding your question, one of the things that as far as my perspective on the healthcare industry for cybersecurity, you know, there's all different kinds of size practices and healthcare systems out there, right? There's single person physician practices all the way to giant healthcare, payers and ACOs and whatnot. One thing that I always want to make sure that I always drive home with any healthcare related entity and client is security and compliance are foundational. Some might have a feeling that it's optional, but when we're talking about healthcare data and patient data, security and compliance are at the forefront and should be a foundation and not optional. Another thing too that I always try to drive home in the healthcare systems is security breaches or related incidents. They have a direct impact on patient care, which is a differentiator across different industries, right? Healthcare is one of the only industries where if there's a breach or something that happens, it can directly affect a single individual or patient. And with that comes a level of responsibility when operating a health-related practice, right, and protecting that information. A lot of the times, when I have conversations with smaller, practices, and they always say that security and compliance is at the forefront of their minds, but is it in practice? Is it being, talked about at the top levels? That's typically what I see in as far as my perspective is, it's all about making sure security and compliance maintain a foundation in any healthcare related practice.
Great. And I think that's kind of an interesting way of framing it, I think, as well, thinking about it like not just from like an organizational level, but like the impact this can have on an individual patient as well. I think that's a really, really important way to think about it. What do you think are some of the biggest challenges that increased security threats in healthcare have been in the last few years?
Well, so I would say one of the biggest items is, with the pandemic, right? We had a rapid digital transformation of many organizations, with having to accelerate remote working, telehealth, being able to provide services, while people are not in the office, are able to see a doctor or, a physician face to face. And with that, though, there was a lot of rapid changes made during that time. And we're seeing that there's an increase in breaches and information that are around these items. Of course, any organization needs to make sure they're assessing the risk of these things, but understandably, when a quick, world level change happens like this, you have to do what you do to make sure the business goes on. But you also have to make sure that as you are doing that, you are still understanding that if you're making a rapid acceleration to a new type of technology, you still have to assess the risks of that. Another thing too is in the last few years, the value of healthcare data on the dark web has increased. And what that actually can mean is that organizations are doing, they're doing a good job at making sure they're managing their programs and, they're maintaining security and compliance and meeting regulatory requirements. But when you make it harder for a threat actor to, get into your environment or your systems to, wreak havoc, that inherently increases the value of that healthcare data because it makes it harder for it to get into, which means it can be sold for more on the dark web, right?
Right.
So those are some of the things that I'm seeing as well. And then also another big item is, IoT devices, medical devices are expanding attack surfaces now too, right? Using a heart rate monitor that can connect to Wi-Fi, things like that. We have to make sure that we are thinking of those things, even at a hospital level. Even individual nurses, using those devices, and they need to have that foundational knowledge of making sure that they are, implementing them correctly.
Right. Yeah. Yeah. Sorry,
Sorry,
Ryan. Yeah. Yeah.
No, I was going to say too, my last point, that I think is a big challenge, and just really in the healthcare industry too, it's resource constraints. Security teams are scarce, I would say, in the healthcare industry. Security teams, they face burnout. I see that there are a lot of staffing shortages, and we need more people in the cybersecurity industry. And that also means that we need to be able to facilitate entry level roles in the world of cybersecurity too, because that's the best way someone's going to be able to get in and get started and get moving. It's what I've seen is kind of a shame that we try to always hire the latest, the best, and the greatest, and people have a very unique experience, but at the end of the day, we're limiting ourselves by doing that, right? Because we're limiting the opportunities of others who want to get into the industry and really be big players and really help mitigate risks for organizations that they work for.
Right. Yeah, great point. And just thinking back to what you said about, how things have changed since the pandemic. Yeah, I mean, overnight, like completely changed how you had to think about security as well. Like, and that's continued to this day. Like many organizations have like completely flipped to either like a fully remote or, a hybrid working environment. So traditionally, your network perimeter was the four walls of your office building or your data center. And now it's, an individual's laptop in some cases, and you're still having to protect your facilities, but at the same time, like making sure you've got good enough security controls on an individual's device and making sure their home network is secure as well. So, I mean, any insights you can help there? Do you feel like it's useful to maybe follow an established framework there that can help like guide you in terms of like what controls would be effective for your workforce there?
Yeah, definitely. I mean, there are, obviously, anyone who works in the healthcare industry knows about HIPAA, right? And HIPAA separated into its three rules: security, privacy, and breach notification, right? But ideally, a lot of those requirements are relatively high level, and it's up to an organization to interpret that correctly and evaluate risk, at more of a higher level. Hence, where HITRUST tends to come in, where HITRUST is an organization that has, really made waves in the healthcare industry around making it simple to maintain a level of security and compliance posture, while still meeting the current threats and vulnerabilities that are out there today. The HITRUST standard is a prescriptive framework that maps directly to, or can map directly to the HIPAA rules, that actually have the prescriptive requirements that you can put in place that mitigate those levels of risk based on your environment. I would say that is one of the best frameworks to get started on because of its ease of being able to answer questions, determining your inherent risks, and then it will come out and tell you what exactly requirements you should be assessed against based on your risk. So it takes a lot of the guesswork out for you. That's one of my favorite ones. And then there's other more industry agnostic standards, like SOC 2 and NIST and ISO 27001, right? They're not specific to healthcare, but they're still good frameworks to help ensure that you're displaying that you are taking security and compliance seriously and you want to mitigate risks to your environment.
Great. I mean, and as well as like thinking about like your own end user devices and your own infrastructure and things like that, then obviously you have to be concerned as well about the security and compliance, posture of any vendors you're working with as well. And, we heard recently from one of our podcast guests that the average health system has, up to 1,300 different technology vendors. And, this amount of connection points, like obviously can put a health system at risk, right? What are some things that, a health system can look for or, ask their vendors to do to ensure that they have a strong security posture?
You're only as strong as your weakest link, right?
Right.
Um, you know, and I really do believe that, right? Because if there's a will, there's a way, and that threat actor is going to look for the easiest, the path of least resistance, right? So ensuring that you have a solid vendor management program, especially if you are sharing any kind of sensitive information or if they have access to your environment for accessing sensitive information, it's extremely important. Um, some of the ways that you can ensure that your vendors really do have a good security posture. One of the things that I see a lot is making sure that they have their own structured compliance programs in place. So, looking at things like HITRUST certification, do they have a SOC 2? Is it a type 1? Is it a type 2? Which HITRUST certification do they have? Is it E1, I1, R2? And then making sure that an organization goes further than that, not just looking to see that they have those things, but looking at the contents, see what findings were there, what issues were there, if any, right? And really documenting those things and doing a risk analysis to ensure that those things that were identified are acceptable to your risk tolerances within your organization. Another thing that can be done too, right, is I'm not necessarily a big fan of it, but there are questionnaires that organizations can send their vendors. In my opinion, I don't really feel like that truly really gives an organization a good picture of an organization's security posture. And really it's a real big time commitment for both parties, right, to review that information. And it really just doesn't provide a whole lot of assurance, right? It's basically a self-attested questionnaire. And if I was in a vendor management department's shoes, I would be looking to check to make sure those things are actually in place on my own. Trust but verify, right? And I am an auditor, so that's my background, right? So it's always not just relying on what you're given every time, but really making sure that what you are being given is true, completely accurate, right?
Right.
And then also making sure that what are the paths that they go through when they are working with you. What's the traversal of information? If you're giving them data, what are they doing with it? Where are they putting it? How's it being processed through their systems? Making sure that you have that information in your back pocket, because if there are issues, right, you need to know what they are, and also you need to know what occurred during that processing as the covered entity, right, or a business associate of another subcontractor. You want to make sure that what they are doing is secure, almost as if it's an extension or is your environment as well. And then at a more technical level too, making sure typical vulnerability management practices are in place. You can ask a million questions about vulnerability management, but are these organizations, are they doing penetration testing? Are they doing scanning for vulnerabilities? How long are they taking to mitigate vulnerabilities? Do they have a plan in place for timetables on mitigating a critical versus a high, a medium, or a low? Those things I think are really important. And then consequently, right, there's going to be times where a covered entity or a business associate might have a vendor that they use, but then that vendor also has a vendor that they use, right? So it's kind of like it's I call it the basically the healthcare vendor supply chain, basically. And a covered entity still needs to make sure that a business associates of vendors are also that are being compliant and secure. And they need to make sure that their business associates are doing that same level of due diligence on their vendors too.
Yeah, so it's important to make sure like your own direct vendors, they meet your own kind of like risk profile and risk tolerance, but also making sure that they have like a very strong third party risk management program as well, and they're passing on effectively the same requirements down to their business associates or subcontractors as well.
Exactly, and doubling up on your point about you need to make sure that their processes follow within your risk tolerance thresholds as an organization, right? It's not just, hey, they do this, or you go with it. Okay, yeah, sure. It's, think about it logically based on your risk assessment processes. Is this an item that, should we accept this? Should we, avoid it? Should we not use this vendor anymore? Should we use a different vendor? Those types of things, making sure that those items are included in your normal risk assessment process.
So, to kind of follow on a little bit from this, so for a health system that might not have like a particularly like mature or strong like security compliance program, like what would you say the value is in like going after something like a high trust certification in terms of kind of helping with, not just the third party risk management we just talked about, but kind of like the overall security posture in general?
Yeah, I know. I know I'm a little bit biased, but I do stand by what High Trust promotes as far as helping health-related organizations become secure and compliant. I think they've done a great job over there at helping organizations of all sizes maintain a level of security and compliance that is satisfactory to their stakeholders and clients and their clients, right? But what's really great about them is they actually have a traversable portfolio where an organization can start at a smaller level and then work their way up, right? So I mentioned earlier, there's 3 different levels of high trust certification, right? There's an E1, which stands for Essentials, 1 year. And then there's I1, which is the implemented 1-year certification. And then there's the R2, which is a risk-based 2-year certification. And on the 2nd year, there's an interim assessment. And, a small organization, the lower level of assessment for iTrust is the E1. It's 44 requirements. That's actually a little bit, at a standard level, that's a little bit less of a requirement count than a typical SOC 2 would have, even if you were doing the security category only. And you still get a certification out of it. You're still demonstrating essential risk management practices within your organization. And the good thing about it too is as your organization grows, your revenue increases, your space in the industry increases, which also increases your vulnerability. You can also increase your level of assurance within the iTrust portfolio as well. So you can move from the E1 to the I1, which is 182 requirements right now. And then even further than that, it's the R2, which is the risk-based, where your requirement count is determined based off your inherent risk factors in your organization. So I like that approach because it grows with organizations as time goes on, and they're doing great things and increasing their revenue and increasing their footprint in the industry.
Great. So yeah, I mean, you don't need to like be overwhelmed by it too much, I guess, and go straight for the R2 straight away with hundreds of requirements, right? Start small and use high trust as almost like, a framework to drive like continuous improvement in your program and work up to the R2 as well.
Yeah, exactly. And the thing about it too is the other good thing about high trust that I truly like is it truly is a risk management framework, right? So it's a scoring model. It's not a pass or fail. It is, you're actually completion of these assessments inherently is almost completing a risk analysis because it's a scoring model. And there's a scoring methodology in place with it. And so, at the end of the day, if there are any gaps or there are any scores that fall below a certain level, it'll automatically generate required corrective action plans. And so, if there is a gap, all the guessing work is done for you. It pops up. It says, hey, you have a gap. A corrective action plan you have to put in for this. Document what you're going to do to increase your score on this and increase your security posture. So it gives organizations a more of an automated fashion of looking at your program holistically, but then also not just doing that, but going the next level of monitoring and managing your any deficiencies that were identified as well.
Great. Well, Ryan, I've got one last question for you, which is what one recommendation do you have that you would leave all health systems with?
Yeah, so as far as basically increasing your security posture in your organization, my main recommendation is it starts at the top, right? being able to get buy-in from leadership in the C-suite levels or with direct board reporting lines is extremely important, because that's where the tone starts, right? And if the tone, starts at lower levels, then that means that there's, areas of the companies where not everybody's going to be on the same page, and not everyone's going to be on board. And I think that that's extremely important. I would also say too that having a clinically aware security program that accounts for patient safety is also important. A lot of the times, we work a lot of times with other businesses, other organizations, B2B, right? And a lot of the times I see that, we want to get this because we want to obtain this client, right? This is going to help our marketability. And of course we have lots of organizations too that, genuinely do these things because they want to be secure and compliant and protect data. But I don't think there's enough of it. And I think we really need to start putting that more in the forefront of our minds, that the ultimate goal, the reason why we're trying to be secure, of course, is to protect our assets and manage our risk. But ultimately, at the end of the day, is to protect patient information.
Yeah. I think that's a great point to leave it on, I think, Ryan. So yeah, thank you so much.
Of course, really thank you. Glad to be here. Appreciate everybody. And, definitely, I look forward to many more conversations about this, and, I'm happy to be a part of it.
Well, thank you, Ryan. Really appreciate you having us join us today.
Yeah. Have a good day.
Thank you.